We travel to the University of Illinois Veterinary Teaching Hospital for this episode of the Paul Report. Just like human athletes, our four-legged competitors can also need physical therapy and rehabilitation. At the U of I, specialists are on site to diagnose and treat horses for a variety of problems and complications. And coming up, we're joined by equine surgeon Dr. Santiago Gutierrez. So stay with us.
Dave's Decorating Center is a proud supporter of the Power Report on WEIU. Dave's Decorating Center features the Mohawk Smart Strand Silk Forever Clean Carpet. Dave's Decorating Center, authorized Mohawk Color Center in Charleston.
Okaw Vet Clinic in Tuscola and Dr. Sally Foote remind you to properly take care of your pets and are happy to help support the Paw Report on WEIU. Okaw Vet Clinic located at 140 West Sale Street in downtown Tuscola. More information available at okawvetclinic.com.
Thanks for joining us for this episode of the Paw Report. I am your host, Kelly Runyon, and as you see, we are not in studio for this episode. We have taken the Paw Report on the road to the University of Illinois Veterinary Teaching Hospital to talk about a very special topic on, well, equine surgery, problems that people may have with their horses. And we are joined today by Dr. Santiago Gutierrez. Thank you so much, an equine surgeon here at the University of Illinois Teaching Hospital. Thanks for joining us today.
Oh, thanks for having us.
You know, we always start when we have a new guest on the Paw Report to have them introduce themselves and maybe tell us a little bit about your history and your background.
Sure. My name is Santiago Gutierrez. I'm actually originally from Argentina. That's where I was born and raised, and did vet school, which I finished in 2001, and I've been in the States since 2002, where I came to do my surgical training and lameness training after that. And so I spent some time in the East Coast, some time in the West Coast, did grad school at Virginia Tech, which I finished in 2008, along with my surgery residency, and came to University of Illinois. And I've been at the University of Illinois since 2008 in August. I was supposed to just be here for a couple months, but I ended up staying a little bit longer. So
we attracted you to Central Illinois, and
right.
You've been here ever since. You mentioned in your discussion about yourself your studies of lameness, and that kind of launches us into today's topic. That's one of the prominent injuries that we may see in horses. Is that correct?
Yeah. So lameness in horses, or lameness issues, are pretty common, pretty prevalent. So we see a fair amount of cases that come in for that particular complaint. Gait abnormality. There are many ways that this can manifest, or clients can pick up there's a problem. So so that's the vast majority of what we do sometimes during the week is just working up lameness, trying to figure out where the problem is coming from, and so on. So
Dr. Gutierrez, I think maybe if you could take us back a step, what exactly is lameness?
So lameness, essentially what it means is just it's a symptom. It's a gait abnormality that horses will have when there is a problem or a disease with one or multiple limbs. And essentially what happens is horses are reluctant to do their given work, whether it's a racehorse, whether it's a jumper, whether it's a dressage. Trainers, owners, clients will have a hard time getting horses to do what they're supposed to do. And so lameness is the most common reason for them not to be able to do their job. And essentially what it is, it's just an abnormality on their gait. It's an abnormal gait. So here at University of Illinois, what we do is we get those horses in. So clients will call and say, hey, I have a problem with my horse, I think it's lame. So what we'll do is we'll get them in and do what we call a lameness workup. What it would involve is we work here with students, interns, and house officers, along with our farrier staff. And so essentially what we'll do is we'll do a physical exam, and then we'll do what we call it lameness evaluation, which it will involve watching the horse move. And when we watch the horse move, what we try to pick up is whether the horse indeed is lame, whether there is a abnormal gait or what we call it asymmetric gait. And if it does, the next step will be to identify what is the injured limb or what is the problem limb. Horses have 4 limbs, so any of those could be the problem or the culprit for this abnormal gait. So the first question that I always ask the students is the horse lame, yes or no? And that's the first thing we want to tell the client, is your horse lame, and this is the reason why it's not performing or it's got an abnormal gait. And if indeed, the next step will be to identify which limb is the problem one. And so it could be a forelimb, it could be a hind limb. Once we have identified whether it's a forelimb, hind limb, or both hind limbs and forelimbs, the next step will be isolated where the lameness is from. And so it's in the lower limb, it's upper limb. And so there are a couple of techniques that we can use to identify where the lameness or the soreness is at. And one of the things that we commonly or routinely do is what we call diagnostic nerve blocks. So essentially what we do is we numb the limb sequentially from the bottom up. So we watch the horse go, yeah, the horse is lame, and so we numb or we perform local anesthesia of a given region of the limb, and then we jog the horse again. And if the horse is better, then we know that that is the area that we need to concentrate on, or where we need to do diagnostic imaging, which will be the next step. So let's say that the horse is lame on a left forelimb, and the lameness improved with diagnostic analgesia of the foot. And so we know that the problem is in the foot, and so the next step will probably do some diagnostic imaging. So the typical will be either x-rays or in some cases ultrasound. Essentially what we're trying to identify is whether there is a bony injury or a soft tissue injury that is accounting for that lameness.
Dr. Gutierrez, is there a particular breed of horse that you see more problems in, and is it an age a factor in problems?
As far as age, they're all over the map. We see horses as young as foal, so 2 to 3 months of age, to, we've seen horses for lameness that are as old as 30, 36, 35. So in terms of breeds, there are also a variety of them that could be prone to lameness as well. So quarter horses, standardbreds, warmbloods as well, thoroughbreds. So there is certainly a great variety of breeds that we work with. So I can't really, name one in particular, because we do see here at University of Illinois pretty much every breed out there. So, and all of them are prone to lameness issues for sure.
You started talking about the diagnosis and the process that you go through to actually pinpoint the horse's problem. Let's expand upon that, because there are so many tools here at the University of Illinois Veterinary Teaching Hospital that you use, one of which is a massive MRI machine that, frankly, I'm amazed at that you can actually get a horse into.
Yeah. Well, I guess, unfortunately, horses don't tell us what it hurts, right? So even though we veterinarians can figure out sometimes where the problem is, sometimes we are isolating the area and trying to detect or figure out what the problem is. And so we have here at University of Illinois, pretty much all the diagnostic modalities out there that are necessary to diagnose or to pinpoint the source of horses' lameness. And so the traditional diagnostic modalities are certainly X-rays or radiography and ultrasound. But here at University of Illinois also we have, when those modalities don't tell us or don't give us the answer or doesn't provide a definitive diagnosis, then we can move up to what we call the more advanced diagnostic techniques. And so those are nuclear scintigraphy, and the newer ones are computer tomography, as well as MRI or magnetic resonance imaging. And so the beauty of this to the MRI and the CT is that we can pretty much detect any injuries that horses may have on the lower limb and it's 100% sensitive to pick up any problems. So it is a luxury to have, and it's certainly very beneficial for lameness clinicians that to have that type of diagnostic tool. So we don't use it routinely. Not every case will need a CT or MRI, but it's good to have the ability to use them in cases where the traditional diagnostic imaging modalities don't tell us what the problem is.
Another approach that you take here at the University of Illinois is a fairly new approach, a teamwork approach, and you work very closely with a therapeutic farrier that is also here on campus. Can you talk about that partnership?
Yeah, so recently we have hired Steve Summershine, an outstanding farrier, great experience and great reputation in the local community. So it's a luxury to have somebody to work with, and we work closely with Steve in cases that require a farrier approach or an opinion of a farrier. And so he's here and staff. So a great deal of these cases, we work them up together. And, veterinarians are pretty good at picking up some problems, but farriers see problems in a different way. So it's always great to have that kind of approach from a podiatry perspective that veterinarians sometimes don't tend to have, or they forget about it. So if there is a case that is not straightforward or something that we are not sure which direction to go, Steve has always been, since we got Steve on board, it's been pretty beneficial, pretty helpful to have him. And also he provides the therapeutic approach to things as well. So the vast majority of horses that we see for lameness have foot issues or hoof issues. And so farriers are heavily involved with the treatment of those. So when it comes down, once we have diagnosed the problem, figured out that it's a soft tissue injury in a foot, for example, we consult with the farrier and determine what the best approach will be in terms of corrective shoeing or therapeutic shoeing. And so having somebody here in-house where you can evaluate the horse together, evaluate the radiograph, the ultrasound, the CT or MRI together, and then determine what the best treatment plan is very valuable. So.
I understand the partnership, and if I'm correct, you're the expert for the internal problems, and the farrier, he's the expert in the external.
That's the best way to put it. Yes. So for that reason, I think that we work great as a team, and we both bring a different perspective to horses with foot injuries, which again is one of the most prevalent problems that we see for lameness in horses.
Do you have a memorable cases, speaking of, pretty severe issues of lameness and foot problems? Any cases stick out in your mind?
There's been several. I can think a recent one that Steve and I worked on was a horse that it was a young warm blood that was recently imported from Europe. It was housed in the Chicago area, and so the client contacted me because she wanted to have a lameness workup because the horse wasn't quite right and couldn't figure out what was going on. So she brought the horse down to University of Illinois, where we did a lameness exam and find out that that both front feet had a lameness issue. And so we worked closely with Steve, and we ended up doing radiograph. The radiograph were inconclusive, so we did an MRI and found what we call keratomas, which essentially are benign tumors inside of a horse's feet. And it was very memorable because this typically is a unilateral condition, and this horse had developed this condition bilaterally. So once we diagnosed this condition bilaterally, Steve and I worked on debulking this benign neoplasia through a tiny window on the horse's hoof that he created for us. So, and the horse went on to do pretty well. The owner contacted me every year to let me know how thankful she is and how happy she was with the outcome.
Speaking of going on, there is a lot of rehabilitation. Once you perform a surgery, there's a lot that goes on behind the scenes, very similar to what humans go through if they have an injury, a sports injury. Can you explain that process of rehabilitation?
Yeah, so I mean, we always talked about rehabilitation. I mean, people tend to think that rehab is something that you will need only after surgery, and essentially I mean, that's not certainly true. You can do rehab of certain lesions that are not treated with surgery. So, and rehab is something that has been around in equine medicine for quite some time. It's more recent that it's gotten some attention, but yeah, so the techniques are pretty similar to the ones that there's been around for years in human. There are some certainly modalities that we have here at University of Illinois that we use to treat soft tissue injuries, just to name a few. Shockwave therapy is one of them for soft tissues. It's a great tool to have. There is also, you might have heard about the use of biologics, so stem cell therapy, IRAP, so all those are two of the most common treatments that horses get a lot of to treat soft tissue injuries that we have here at University of Illinois. So those are just a few of them of what we have here in house that we can use to treat and to rehab horses after injuries.
Biomedics plays a part in this too, biosciences, and you're an expert in that, and that kind of plays into what you have to look at and what you have to study before you launch into this rehabilitation plan. Is that correct?
Yeah, so that is a very important component of what we do at University of Illinois. So it's just to put some science behind of what we do, and certainly the lab stage or developing these treatment options in the lab is a very important part of what we do. And so here at University of Illinois, we have fairly active research groups that have developed different lines of treatment for this type of injuries, both soft tissues and osseous injuries in horses. So it is great to be able to apply what some people have worked on for years and determine that this is the best treatment in terms of these new biologics in horses. So,
how long is a horse usually here for rehabilitation? And then once their stay at the University of Illinois Teaching Hospital is over, they do have to go home. And that treatment has to continue with their owners or trainers off location.
Yeah, so the treatment, how long horses need to be here for is, it really depends on what kind of injury we're treating, what kind of treatment we're providing. And so it certainly varies. If it's something that can be done at home, I'm a great believer that horses shouldn't really stay at the hospital. They don't need to. It's like people. So we try to send those horses home right away, and especially if the trainer, owner, or caregiver can provide or can do some of those rehab techniques that most of them are able to do. Now, there are situations where that's not feasible, so we keep horses here for a week, 2, sometimes a month, depending on what's going on with those horses. So, so it really depends, but we do have certainly horses spend a fair amount of time here at the hospital if they need to be rehab or if they need to be treated with platelet-rich plasma or the stem cell, or if they need a recheck ultrasound, things of that nature, or in cases where the rehab cannot be done at home.
Do you work very closely with the owners, caregivers, trainers on a plan so that when they leave here, they know exactly what to do, because they may not be as experienced as you are?
So that's one of the most common questions that we get from clients. So, what they want to know is they want to have the to-do list of things they need to be doing. So we provide clients with, the different steps that they should follow. Also, I work closely with them as well after the horses have gone home. So they reach out to me either via phone or email, show me pictures and tell me, hey, give me updates and let me know how they're doing. If they need to, they can move forward. So, and oftentimes we have them back for a recheck. That's one of the things that we are pretty pretty emphatic about that doing rechecks when things don't seem to be going in the right direction is highly recommended. So we try sometimes to get those horses back every 4 to 6 weeks for rechecks, just to make sure that the rehab and the recovery process is going in the right direction.
Another magic question people probably ask you is my horse going to get better 100%? Are they going to heal 100%? It's the same thing that we humans go through when we are in the hospital, we have an ailment, we have surgery. Am I going to be completely healed? What is the success rate? Maybe that you've experienced. I know you can't put a pinpoint to it, but maybe talk about all the procedures and things that you've done. You've seen the horses improve and heal.
So yes, in certain cases we can give a fairly accurate prognosis in terms of what the level of soundness is going to be down the road. So if a horse has got an injury to a tendon, what is the success rate? What is likely going to happen? And I would say the vast majority of the cases we can generate a fairly accurate prognosis. There are cases where there are certain factors that suddenly that play in that we can't really give them an accurate prognosis. But it really depends. For foot injuries, I think that the prognosis is by and large fairly favorable or good. There are certain injuries that are fairly severe, and those horses don't tend to recover from. But I would say that the vast majority of them, horses can certainly recover from and have still be able to perform. One of the things that we've seen is that maybe horses will decrease on the level of the performance, so they may not be as high level athletes as they used to be, but they can still perform to a certain level. So with certainly over the years, we learned that there are certain injuries that don't do as well as we hoped, and so for those we have developed newer techniques. So stem cell treatment, for example, is one of those that have helped to improve the outcome of certain soft tissue injuries, tendon or ligaments being one of them, being a good example of them. And certainly there are cases where if the traditional approach doesn't render the horse sound, then we can recommend doing the surgery or doing surgery. Mm-hmm. And I tend to recommend surgery when I feel like the prognosis is at least 70 to 80%, give 70 to 80% chances that the horse will be sound afterwards. So certainly we try to do surgery on horses that the prognosis wasn't as good, but we try to be very honest and very frank with people, and recommend surgery if we think it's going to certainly be beneficial in terms of soundness down the road.
Well, we do appreciate you speaking to us today about your job, your position, and what you do here at the University of Illinois, and also issues that horse owners may encounter. If somebody out there does notice something kind of quirky or out of sorts with their horse, obviously they're encouraged to call the teaching hospital and be
Absolutely.
put in touch with you or an assistant of yours to maybe answer some questions. That's where it could start.
Yeah, so here at University of Illinois, we have a great team. We talked about the farrier, but also, and I think I might have mentioned it, but we have a great group of students, interns, and residents that, and faculty as well, that help us navigate through the day for sure. So we highly appreciate having this team approach here at University of Illinois that certainly give us different perspective to certain problems, and it makes our job a lot easier. So
I should thank you for inviting us. And, I should have started this at the beginning of the program, but this is your office. This is
my office.
This is not your desk and computer like most of us are used to. This is it.
This is where I spend most of my time. Yes.
And this is, if you could just briefly explain behind us.
This is the orthopedic operation room. This is where we perform tendon surgery, ligament surgery, joint surgeries, which we do a fair amount of those. You can see that monitor on that tower. This is how we monitor when we do interarticular surgeries for interarticular fractures, which is something that horses have very commonly, and this is one of our surgery table where we put horses to sleep while we operate on them. Of course, we can't do them while they're walking around.
Right.
So,
a little bit bigger than the human table that
Right.
most of us are used to.
Yeah, so here's where I spend my time from 8 to 5 during the week.
Oh my. Well, Dr. Gutierrez, thank you for for being with us, for inviting us to your office and sharing the information today.
You're very welcome.
Very informative. And thank you for joining us for this episode of the Paw Report. Until next time, I am your host, Kelly Runyon. If you're a veterinarian, trainer, groomer, specialist, rescue organization, or shelter that would like to partner with the Paw Report by providing expert guests for the show, please contact us by emailing weiu@weiu.net or call 217-581-5956. If you have a topic you'd like to see on the show or questions for our experts, contact us with those too.
Okaw Vet Clinic in Tuscola and Dr. Sally Foote remind you to properly take care of your pets and are happy to help support the Paw Report on WEIU. Okaw Vet Clinic located at 140 West Sale Street in downtown Tuscola. More information available at okawvetclinic.com.
Dave's Decorating Center is a proud supporter of the Paw Report on WEIU. Dave's Decorating Center features the Mohawk Smart Strand Silk Forever Clean Carpet. Dave's Decorating Center, authorized Mohawk Color Center in Charleston.